Hello, I'm Rimuraj Arnon. Here I'm going to talk about a small topic regarding health promotion. So, health promotion. The importance of health promotion lies in its proactive and also the preventive approach to improve the individuals and also to improve the community health as well. So, it mainly helps to prevent the diseases and encourages the healthy behaviors such as good nutrition and also regular physical activity, and thus by reducing the lifestyle diseases as well. So next one is improves the quality of life. That is mainly by promoting the mental, physical and also the social well-being. And next one reduces the healthcare cost. That is mainly prevention. That is mainly by the tagline prevention is better than the cure. So if you are preventing a disease not to be not to be getting into more severe states, so that is mainly the most important one, and empowers the individuals and the communities. So that is mainly by educating the two people about the healthier life as well, and also encourages the healthy environmental health promotion goes beyond individuals, and such as in schools, colleges and medical campaigns, and also medical camps, conducting medical camps, etc. The next one reduces the health inequalities. That is mainly by targeting at the risk population and also addressing a social determinants of health like income, education, so that they can help to choose the gap in the so they can help to close the gap in between the health disparities as well. So this is the health promotion model. So there are the seven domains. It's regarding the prevention, lifestyle diseases, lifestyle changes, prevention, and what are the policy makers, what are the education we have to be done, what are the health education, and also the policy protection and support as well. So these are the current models of a health promotion. So first one is a medical model. So we can see from the name itself, we can see it is mainly helps to prevents the diseases, and also its mainly approach is mainly using the medical interventions to reduce the illness. And role of the professional here is mainly to the expert who diagnoses and also treats the diseases as well as. So what is the criticism? That is mainly reactive, and it is mainly focused on the illness, not on a holistic approach as well. The next, coming to the behavioral change model, it mainly focuses on the individual lifestyle choices as well. Approaches encourages personal responsibilities for health as well. Example, health education campaigns, and the criticism what they have faced is mainly ignore the social or the economic factors, which is what the influencing the behavior of an individuals. The next one is mainly the education model. It's mainly focused on the knowledge and also education given to the individuals about their healthier lifestyles and all. So what is the goal? Empower people with knowledge. For example, the nutritional diet and also the meal planner, etc. And criticism assumes that the knowledge cannot change the person's behavior as well. And the next one is empowerment model. So focus mainly enabling the individuals and also the communities to take part of their health. So approach, it is a collaborative and it is a supportive approach as well as. And mode of the role of the professional is mainly here facilitator. And also what is the strength is mainly encourages the equality and also addresses the social determinants of health as well. The next one is mainly the social change or the socio environmental change. So it is mainly focusing on the social and also the environmental factors also. So it is approach is mainly targeting policies, living conditions, etc. Example, we can think about a smoke free legislation and also a school meal policies as well as. So strength is mainly tackles the root causes, just not the symptoms. It is mainly tackling the root causes as well. So this is a current summary of the current models, medical model, and also focusing on the disease prevention. And the behavioral change model mainly encourages the individuals to choose their own lifestyle. Education model is mainly educating the peoples. Empowerment model is mainly educating the peoples as well as, and also communities to take control of their health and all. And also what is a social change model? It increases and it addresses the broader aspect of the social and the environmental factors which is affecting the health. So we can take together these all models to a comprehensive approach for the improving the health outcomes. So here I'm taking comparison of two models. So the first one I've taken is mainly the behavioral change model. We all know it is mainly to implement, easy to implement in the clinical settings, and also it is also limitations often places responsibility completely on the individual as well. So often ignores the social, economic or the cultural barriers to change for this one. And next one I've taken is mainly the empowerment model. Strengths we can see promotes a long term and also a sustainable health improvement, addresses the wider social determinants of health as well, limitations that can be time consuming. Okay, and also the resources are intensive, may require the organization and also the policy support as well. So I have made a tabular column comparing of this both models. So the first one is the behavioral model and the second one is the empowerment model. So we can see what is the focus. It is individual, a lifestyle change, and the empowerment model is mainly the community control approach. We can see in the behavioral model, it is a directive and educational one, and empowerment model, it is a collaborative and a supportive one. So what is the role of nurse? In behavioral model, we can say it is an educator, and in an empowerment model, it is a facilitator. So what are the strengths? It's targeted and the measures outcome. And here is mainly a holistic approach as well. So what are the weakness? Mainly in behavioral model, ignores all the social context. And empowerment model, we can see the resources are very heavy and it is really a slower process. So that is evaluation summary. We can see that is medical and also the behavioral models is a short term one, and the education and the empowerment model is mainly a long term, and also it mainly depends upon the self care as well. And social change model is mainly more addressing on the health inequalities and also empowering the public health to a very systemic level as well. So next one we can talk about the health promotion initiative. So here the health promotion initiative I've taken as mainly change for life. It is mainly focused upon the obesity, and it is a wide spectrum aspect. Not in UK, all the worldwide, many of the peoples are really obese. So aims and objectives to reduce the rising level of obesity and related health issues in children and families by encouraging healthier lifestyle choices. So we can see what all the change for life campaigning obesity have made changes in the individual's life as well as in the community as well. So this is a picture of a obese person. So we can see what are the risk factors is affecting from. We can see age is one of the risk factor, genetics, lack of physical activity, and also the hormonal imbalances and stress is the most important, symptoms we are facing. Most important symptoms that is going through the obesity is one of the most important symptoms is stress as well. And also what are the prevention to change into a healthier life, and to consume low consumption of the sugar and salt, no alcohol, no smoking like that. And what are the consequences if you're continuing like a obese as well? So there is a chances of lung disease, liver diseases, kidney diseases, diabetes, heart diseases, stroke, and whatnot, cancer, everything. So it is just a we have to change ourselves, we have to change our life pattern. So that is a obesity bio infographic. So how we can find out that we are obese, or that how we are find out how we are underweight, overweight, or obese, or moderate. So we have to first make a, basal metabolic index. We have to find out the basal metabolic index. So by age, weight, and also height, we can find out what is a basal metabolic index as well. And thus we can plan according to the diet we want to consume in a day. The next one, what are the objectives? So, raise awareness of the risk of obesity and unhealthy lifestyle diseases, promoting balanced diet which includes more fruit, vegetables, and lower salt and also sugar, encourages the physical activity, support parents and carers in making healthier choices for their families, provide accessible low-cost resources, example the meal plans as well. So this is the 12 tips to be healthy. What and all changes we have to be made in our life. So we have to make increase in the physical activity, and we have to make changes in the alterations of our diet as well. So it all contains the 12 tips to become healthy. And this was, this image was being taken from the World Health Organization. And now we can say about what are the effectiveness we have been by the evaluations of this Change for Life campaign. So that is a national reach. Change for Life has successfully reached millions of households through ad, posters, schools and social media. It is one of the UK's most recognizable public health brands aims at families on obesity and behavioral changes. According to the evaluations by Public Health England, over 40 lakh families were being registered for this Change for Life, and schools were using the 10-minute shake-up pack. So a raise in daily physical activity and used in over 20,000 schools and early settings. So it's changed, it made a very tremendous change as well. And this is one of the ad used for the Change for Life posters, and it is a very attractive ad, mainly to attract the children and also the young generation people. And what are the analysis have been done through the Change for Life? So it is a core strategy, so a preventive health campaign targeting the families to improve the long term health habits, focuses on obesity related behaviors, unhealthy diets, sedentary lifestyles, and also lack of knowledge. So what are the key delivery channels they have used? Is mainly TV, multimedia, and also educational packs in schools, general practitioners in NHS, and also early year settings as well. Partnerships with supermarket like Tesco and also Asda to promote the healthier choices, like a snack pack like that, a meal pack also. The next one, reach and also engagement. So reached million of households across England through national campaign, high brand recognition among parents of young children, and the behavioral changes example, that is increased awareness of sugar content in the drinks or snacks, and also reported changes in food shopping and also portioned in controlled behaviors as well as. The next, what are the contributions to improving public health? So, Public Health England made a significant contribution to improving public health in UK through the Change for Life initiative, particularly addressing the obesity among the adults and children. So, key contributions are strength, raising awareness at national scale, used mass media campaigns to make the public more aware of the dangers of obesity, clear message about the sugar, fat, portion sizes, activities help families to understand the link between the lifestyle and also the long term health risk as well. Empowering behavioral changes, Change for Life offered practical, free resources such as meal planners, snacks, naps, and physical activity ideas for parents and schools, and applies health belief models, perceived severity, and also benefits for lifestyle change. Campaign like Sugar Smart app were being used to enable the families to scan the food products and makes the healthier choices on the spot itself, and reducing the health inequalities focused on reaching the disadvantaged communities where obesity rates tends to be the highest. Next one, tailored accessible communication, language and the visual designs are even very understood for the low literacy and also for the different types of audience as well, and inclusive of varied socio-economic groups. Holistic lifestyle approach have been considered, covers the diet, exercise, the screen time, and also the sleep hygiene, and encourages the whole family involvement for better success as well. Working with local authorities and schools, Change for Life was supported by local councils, general practitioners, schools, and children's centers, creating a multi agency approach to public health. Thus, ensured a consistency of messaging and improved access to the services and also the advice. Contributing to national policy, the data collected from the Public Health England campaigns helped to shape the government strategies like the Childhood Obesity Plan and also regulations on the sugary drink taxation and the junk food advertisement. These are all the advantages and the strength and what all the contributions given to the public health. For everything there will be a criticism and also a limitations. So we'll find out what are the limitations have been faced for the Change for Life campaign regarding obesity. So there are some limitations access as well. So inequality of access, so the families in low income areas may lack of some resources For example, digital tools not always accessible to those without smartphones or internet. So we are considering about the inequality of access. I think in most of the population, about 75 of the population is having a smartphones and also the internet connections. So that is only up to a very small portion of the percentage is having the low income, low income and low access to the less access to the smartphones as well. And short term impact, because many of the schools are supporting for that, and not on the families, because it's a holistic approach. So many of the families are not on the families, or the communities, the schools, the colleges, and also the local communities also supporting for them. The next one, we can talk about the short term impact. Most evidence based upon the self reported short term behavioral changes, lack of robust data on long-term overt outcomes or the clinical impact. So that is mainly based upon the behavioral problem of a or behavioral changes of a individuals, because we are basing upon a long-term process, not for a short-term process. So we have to be targeted to the aim. And next one, the structural gaps. Focus is on the individual responsibility with less attention to the broader determinants, and the environmental barriers remain unrest. So what are the environmental barriers here remain unrest is mainly about the food, and also about the deserts, what they have to be consumed. Next one, commercial conflicts. So there are retailer partnerships may undermine these public health goals by still promoting the unhealthy products with high calories and with a large intake, greatly intake of the salt and sugar in the drinks as well. So next one, potential for greenwashing by brands involved. Next one is campaign visibility has been reduced in recent years due to changes in funding and restructuring in the public. So that is one of the major problem, major limitations, because if it is a long term basis, we need a funding, and also to make a restructure in the public community, we need funding as well. So that is one of the major limitations faced by this one. And no continuous reinforcement or major updates to the campaign tools as well. So next one, we can conclude this presentation. So we have seen what is a health promotion, and what are the models, current models of a health promotion, what are the comparisons between the health promotion models, and what are the health promotion initiative have taken. Obesity, what is its aims, objectives, evaluation, analysis, strength, and also in what are the contributions and also the limitations. And now we can conclude that the Public Health England, through the Change for Life initiative, has made a valuable contribution to improving the public health in UK by promoting healthier eating and physical activity, especially among their children. Its wide reach collaborative delivery model and focus on reducing inequalities show how public health organizations can empower individuals and influence national health behavior. However, it is a long term success, requires a continued investment and a broader societal change. So, all of the society have to be, hand to hand to improve this initiative. And these are all the references have been taken. So first one is mainly from the study materials from the Learn Direct UK and Department of Health and Social Care 2020, tackling obesity, empowering adults and children to live healthier lives, gov.uk. NHS 2023, Change for Life, NHS Choices, Public Health England 2016 Campaign Evaluation Report, World Health Organization 1986, a Charter for Health Promotion, National Audit Office 2020, Tackling Obesity in England, and also the images have been taken from Slideshout, the WHO, and also opener.com. And thank you for listening me. Thank you very much.